Thank you. It's a pleasure being here this morning, and I want to thank the organizers for having me. I'd like to talk about some optimism. That is, there are strategies that can help. Good. This next slide shows the paradox. This green? Yeah. Oh. The paradox is, you know, 2/3 of us are overweight or obese in our society. So the question is, why the heck is that? If the interest is clearly there, but because of all kinds of factors that we've heard about from the speakers this morning, and remember also the emotional factors, stress, tension, anxiety, depression, loneliness, anger, boredom, all of these factors, people try to medicate themselves then with food, eating late at night, binge eating, and all of these factors also play a major role. I think the bottom line is not so much weight itself, but a healthy lifestyle. And to me, a healthy lifestyle is just eating sensibly and trying to be more active. If it were easy, we'd all be skinny. Clearly, it's not easy to do that. So I think the focus should be on a good, healthy lifestyle. Instead, what we know in our society is this. My favorite restaurant up in Amarillo, you know, the Big Texan Steak Ranch, 72-ounce steak, free if you eat it under an hour. If you eat there too often, of course, you're going to get yourself in trouble, and you wouldn't really want to eat at the Big Texan Steak Ranch every day. And then coupling those big portion sizes we have here in Texas is lack of physical activity. So, you know, you put the two together. I mean, the point is, why should you have to walk from your boat to your home when you can drive from your boat to your home? So we all know, we all have examples of what's going on. I think Twain said it best. If you're ever going to change habits, habit is habit, not to be flung out the window, but coaxed downstairs one step at a time. So in other words, I think for all of us to achieve a healthy lifestyle is to really focus on small steps that all of us can do rather than these crazy diets that you always read about. There are 5 basic steps, I think, to a healthier lifestyle, and they are raising awareness, confronting barriers, managing emotional eating, reversing relapse, and then really maintaining a healthy lifestyle. The first and foremost one, as all of you know, is this. It's the food diary. That is self-observation, bacon and eggs, self-recording, bacon and eggs, feedback, looking up the calories. So, you know, everybody hates doing that, but the step has to be, first is, if you want to change behavior, you got to know what behavior you're going to change. So along with that, of course, is weighing on a regular schedule. If you want to change your weight, you got to know what you weigh. And so the factors really are food record, activity record, which is this, you know, the pedometer, 2,000 steps is a mile, it's 100 calories, 10,000 steps a day is roughly about, you know, 500 calories, so roughly, and weighing on a regular schedule. Step 2, of course, is confronting barriers. This says, luckily, Rhoda was saved from overeating by her refrigerator's airbag. You're looking for reminders to remind yourself to eat on a healthy schedule. So this would be things like normalizing your eating pattern or laying out your exercise clothes, all these things we know that we should be doing, but looking at what the barriers are and then actually confronting them. Third, and I thank Dr. Beer for this Dalai Lama slide, but what the Dalai Lama says to manage emotional eating is, if a problem is fixable, if a situation is such you can do something about it, there's no need to worry. If it's not fixable, there's no help in worrying, there's no benefit in worrying whatsoever. But even remember, if you're a bodhisattva, you still got to get on that treadmill every day and keep your weight under control. So managing emotional eating, there are lots of ways to do that. Physical activity is certainly one of the best, but meditation, Om Mani Padme Hum, progressive relaxation, there are lots of ways to do that. And then, of course, really focusing on preventing relapse by eating healthy as a family, recognizing and planning ahead, really learning to control urges, and having good support, as we heard one of the questions earlier. There are a lot of good support groups available. And then finally, the 5th step is maintain a healthy lifestyle. This is from the National Weight Control Registry data that have people who have lost a lot of weight self-report and have kept it off for many years. So they did a recent survey last year on 3,000 of these members and tried to find out what exactly do you have to do to maintain a good, healthy weight loss and then maintain a healthy, keep that weight off, 50 pounds or more. And they do 10 things, at least they report they do 10 things. They track their food intake every day. They count their calories or fat grams or food groups or Weight Watchers points or whatever it is. They follow a low-calorie, low-fat diet, 1,800 calories a day, less than 30%, so a good American Heart Association type diet. They eat breakfast regularly. They limit the amount they eat out, no more than 3 times a week. They eat fast food less than once a week. They eat similar food regularly. In other words, they follow a pretty same diet. They don't splurge much on Christmas and other holidays. They walk about an hour a day, so that's about 300 calories. They watch less than 10 hours of TV a week, and they weigh themselves regularly. So there you are. I mean, there are 10 basic steps there to maintain a healthy lifestyle. So what we've been doing is looking at all of those strategies from a lifestyle point of view and putting it into the Look Ahead trial. And I want to mention our data on that and thank Scott Grundy, who's been for the first 8 years of the trial as head of the Data and Safety Monitoring Committee on this trial. But this is an ongoing NIH-funded 14-year multi-center randomized clinical trial to evaluate the health effects of interventions designed to lose weight and keep it off. What we've done is recruit and randomize nationwide 5,000 overweight and obese people who have type 2 diabetes. So all of these people are heavy and they all have diabetes. It's called Look Ahead. Look Ahead is just an acronym for this action of health and diabetes. And what we're trying to do from a randomized control trial is see if you're heavy and you lose weight and keep it off, you're going to live longer. So mortality is the primary outcome in this trial. There are a lot of secondary outcomes also. So there are 16 centers in the United States that have randomized these people. The primary endpoint is a composite of cardiovascular death, including heart attack and stroke, and non-fatal heart attack and stroke. So the primary outcome we're looking at is mortality. That is, if you lose weight and keep it off, will you live longer? Here are the clinical sites. Texas has 2 sites. Baylor is one site, and San Antonio with Helen Hazuda is another site. So 2 of the 16 centers are in Texas. We've randomized over first 2.5 years of this trial, 5,000 people plus, into a lifestyle, which are all of those factors I mentioned in the first few minutes of my talk, raising awareness, confronting barriers, et cetera, et cetera. So it's a diet exercise approach, intervention. We don't use drugs other than the patients are on their own diabetes medication, but we don't use drugs in this trial. It's just diet, exercise, and lifestyle change strategies that I outlined for you. So you see that randomization does work. So we got 2,500 plus people in each category. DSE means Diabetes Support and Education. That's our control group. They come in a couple times every year to get a little information about diabetes, foot care, eye care, etc. But the lifestyle group comes in regularly and they get information, they get behavioral strategies. So the goal is a 7% weight loss, which is shown in the literature to produce nice changes. 10% for the individual, but the trial is powered at 7%. That's about 15 pounds. So about a 15-pound weight loss is the goal, and 30 minutes of walking 5 days a week. So 35 minutes of walking 5 days a week, 175 minutes a week. So that's the goal. That's the intervention and the behavioral strategies to do that. So here's our data. After the first year, the 2,500 people who are in the treatment group lost 8.6% of their weight. That's about just under 20 pounds. The goal is 7%, so we exceeded our goal. So even people with type 2 diabetes that receive a good lifestyle intervention lower their weight compared to the DSE, which is the control group that lost less than 1% of their weight. Fitness, we use treadmills to measure fitness, not self-report. Fitness in the green line, which is again our treatment group in these people who are heavy and have type 2 diabetes, goes straight up. Big increases, big statistical increases in fitness. And I just show these slides to remind me to say that all of our factors, all of the biomarkers, everything is significant so in the treatment group. So these are markers in diabetes control, so hemoglobin A1C, fasting glucose, diabetes medication, all within the group and between groups we see significant data. Blood pressure, systolic blood pressure, diastolic blood pressure. In other words, with an 8.6% drop in weight, you get wonderful metabolic changes. Lipid control, LDL LDL, both groups came down because many of these patients are on statins, but both groups were very effective in LDL. But HDL goes up, triglycerides go down, everything really, medications drop, etc. All of these patients have diabetes, of course, so the patients in the intervention group, these are the percent of people who are following American Diabetes Association goals. That goes dramatically up in the treatment group. We've just published last year the Foreyt data, the end of 2010. Do they keep the weight off? Yes, they do. They do very well after 4 years. They're still in intervention, but they went from 8.6% to an average weight loss of 6.15%. So they gained back a little bit, but on average, they're still, and all of the factors are still down, all of the biomedical factors. We're just getting ready now to publish the 8-year follow-up data. This is a 14-year trial, but the 8-year data will be submitted very, very shortly. And I just want to show you this one, because when you read these studies in the literature on drugs, if you're doing a drug trial, generally you'll see a 50% dropout rate at the end of 1 year. 50% dropout. That's why a lot of these drugs are having trouble getting through, not only the side effects, but the attrition. So they don't know what happens to the people that don't show up for the one year or 2 year measurements. Look at the percent that people come in both groups. The intervention group, even after 4 years, 94% of these people are still coming in for measurements and et cetera, et cetera. Even the comparison group, 93%. So in other words, all except for the patients that have passed away, we're still getting almost all of the patients are still part of this trial. So even after 4 years, 4-year results showing that with a lifestyle approach of small changes in eating, small changes in physical activity, using those behavioral strategies to encourage people to make these changes, we get all of these changes in racial groups, ethnic groups, men, women, all of these people who are on insulin, they all come down very, very nicely. Lifestyle produced weight loss in all groups. So my final words to all of you guys is the goal as healthcare professionals is to get people off the couch, not to get skinny, but to really focus on eating healthy and exercising regularly through small changes. I think Boyd Eaton said it best. The current epidemic of chronic diseases are the result of a discordance between our ancient genes. We're all hunter-gatherers. We all have the hunter-gatherer genes. I think the problem for many of us, we're just not hunting and gathering, and our modern lifestyle. So I think, John Milton said it great. Accuse not nature. Nature's done her part. We have a wonderful diet. We can all eat healthy. We can all exercise regularly. Do thou but thine. I think what that means to me is what I eat for lunch today is up to me. It's my personal responsibility, and that's where it has to start. Then, as Dr. Dietz and the other panelists have said, the more we can change the environment to make it easier for me to eat healthy, to be active, that's the bottom line. It's this combination of personal responsibility plus environmental change that will eventually help control body weight. So finally then, the secrets of successful weight loss, all of these are evidence-based, by the way. Every day, sleep 8 hours, as I'm sure you all do, eat breakfast, walk briskly for an hour a day, write down what you eat and look up the calories, weigh on a regular schedule so you know your weight, find a support group, family or other support group, and never give up. Find my last slide, if Obama ever appointed me fat czar, I'd work with children, as we heard Dr. Beer and others and Dr. Dietz talk about. There's no question that the future are kids, not putting them on stupid diets and so on, but finding ways for them to be more active in the backyard or wherever it is that's safe, schools, as Deanna was talking about, and then finding ways to get them to eat healthy and exercise regularly, and that's the bottom line. I think then and only then will we see a reduction in the prevalence of obesity in our society. Thank you.
Hi, could you say a little bit more about the scientific connections between sleep and obesity? My personal experience is almost all diet problems I have are related to excess waking hours and insufficient sleeping hours.
Well, there's a real good literature on sleeping, as regular sleep is a very important, that's why I listed that #1 on my Secrets of Successful Weight Loss. generally you can always see that most of us should be getting around 7 or 8 hours. Everybody's different, obviously, but as a mean, as an average, as one measure of, and these are all what you would just call correlates, you know, of healthy maintenance of body weight. But one of them clearly is sleep. There's no question that people who have trouble sleeping, many of them have a problem also then managing their weight. And part of that is binge eating or eating late at night. There are all kinds of reasons why. But the literature shows, at least suggests from a correlative point of view, that sleeping is one, just like breakfast is the same thing. I mean, to me, it's just a sign that people who eat breakfast probably have their life in better control, you know, and so, you know, as opposed to people who are always jumping around and never eating breakfast. You know, there are reasons for all these things, or correlations, but the bottom line is sleep, breakfast, and so on. These are all really they all fit together, I think, from a lifestyle point of view. Dr. Schein.
The evidence with regard to cigarette smoking is extraordinary in terms of cigarette smoking beginning for well over 90% of people under the age of 21. The data that Bill has shown that we've seen today suggests the ratio of adult obesity looks like it's something of, in the range of 150% of the ratio in children. And I'm curious as to what are the predisposing factors which identify what proportion of the adult obese people are in fact obese as children, and then what are the factors which influence the other half, if you will.
Yeah, it's a great question. You know, the literature shows, and depending what study you read, you know, all of these have different, depending what sample you're looking at, but many of them, like Epstein and others, have shown that as kids get older and they get heavier, it gets harder and harder to then lose the weight. So generally teenage kids, you know, who are fat will tend to grow up to be heavy. Not all, obviously some of them don't, they grow out of their weight. And the same with littler kids. You know, the percent of kids who are fat, and we're seeing it now more and more because of as kids are getting heavier and heavier, that's part of the reason we're seeing this explosion in prevalence of obesity. But Denny, do you want to comment or anything about percent-wise, or?
I don't know that we have an answer more than you said. The earlier you get fat, the fatter you are at the end. Okay, yeah. And I don't think that we understand why that is, but there's a significant fraction of people who don't get fat as children, you know, but who get fat as adults, and I think that potentially is a different group than
I do too.
the
That's a good
individuals
point.
we've been talking about.
Yeah, thank you. Yeah, I think so too, that people who get fat as adults are quite a different group than these kids who are fat all their lives. Well, that's what we're looking at. So, yeah, Deanna.
One of the periods is when women have a baby. So a lot of times that
Good point.
disposes them to gain extra weight after they become pregnant. So that's another.
But you're right. I mean, you're right. There are lots of different factors. So, Ellen?
So that was a great talk, John. In fact, all the talks have been fabulous. And I just want to ask you, this is the first study that I know of that has had such powerful results, and it'll be interesting to look at your morbidity and mortality results as well. But do you think the fact that these individuals had diabetes was a critical issue in the study's terrific outcomes so far? And if you did the same thing on a group of healthy, at-risk adults, do you think you'd get the same kinds of outcomes?
That's an excellent question. Because the primary outcome is mortality, we had to take a group of people who are at high risk for mortality. So that's why we took people who already have diabetes, as opposed to an obese, healthy population where you wouldn't get the mortality over 14 years. So that's why. But in terms of to answer your question, yes, many of these people are very concerned. Many of them come into my clinic every week just to weigh, even though, you know, to see our staff and so on. So they're very, very concerned. And I think that is a big factor. We're still blinded to the primary outcome. So all of the principal investigators, we don't know the mortality data yet. We know the morbidity data, but not the mortality data. We'll know that in another 5-6 years. So thank you.
Is there a relationship between regular exercise and sleeping habits?
Is there a relationship
Regular exercising and sleeping habits?
between? Well, always see that. Steve Blair reports that people who exercise regularly sleep terrifically. I mean, he's got data to show that. But again, all of these data are correlational. But yes, I mean, the answer is the exercise people publish those data regularly. And they, if you exercise regularly, you're going to sleep better, according to them. And I agree with them. I mean, it seems to be so. But is that causal or is that correlative? Certainly the correlation's there. Larry?
Two last questions.
Oh, okay.
Please,
Sorry. Okay.
questions short
And I'll, sure.
Dr. Dietz showed that very dramatic slide about smoking and
Yeah.
a rapid decline. And so I just have to ask the question, it's connected with the comment just a moment ago. As adults have dropped smoking, because it's very dramatic, the encouragement to do that at the workplace, everywhere you go. I had professors that smoked in class, so it's a very different world today.
Yeah.
And does this have anything to do with adults, not the ones that started already heavy as children, but that develop overweight as adults, that they're not smoking?
The relationship between smoking and weight? Oh yeah, there's no question that the data with smoking and weight, people who smoke tend to weigh less. And many people start smoking again, after they've lost. So there's a real issue there, the problem between smoking and weight. People who smoke weigh less.
Last question.
Okay, sorry.
I have an NIH National Heart, Lung, and Blood trial, and we see patients coming in for imaging, lymphatic imaging.
Yes.
And we have this really wild group of patients that have rare adipose disorders. They are classified by their physician as being obese, but I've seen them. These people eat next to nothing, they exercise, and they have really unusual fat deposits. Some of the rare diseases, they actually die of non-cardiac events. And I guess my question is not so much to you, but perhaps to the whole panel, I haven't heard anybody talking about rare adipose disorders, Mad Lungs disease, Darkham's diseases. They're rare, but do they have any significance in the common disorder of obesity, especially when they're obese patients that are refractory to treatment?
Well, the problem, of course, is we measure obesity through BMI, and BMI has nothing to do with body fat. So you get a whole problem of people who are fat, who are very thin, and because of the percent body fat, and vice versa. So you have all of those issues, like your sample there, your population is a very interesting one to study and look at that specifically. So I'd love to see more data on adipose tissue as a measure of obesity rather than just BMI. So.